Okay, so James, when we first started working on this project with the Northdoor team and your team, you talked about the recognition that you were using an old data warehouse that was aligned only with the Maidstone Trust, and also in terms of the BI reporting tools, you were using Excel and point solutions rather than an enterprise level BI solution. You've subsequently since then built out a new data warehouse which is shared cross-county, which follows the initiatives that are being set by NHS England and NHS Digital in terms of shared services and shared cost. And you've brought in Microsoft Power BI P1 Premium as the new BI tool. I think we talked about sort of 4 key areas that you were looking to enhance. One of those was the need within the NHS to share services and share costs, and obviously that's been achieved with this solution, which is fantastic. But we also talked about the other 3. One was about time to insight, so getting information to consumers, the consumers that you spoke of earlier. Has that objective been met with Power BI?
So we're still on a journey with that, if I'm honest. The reports that we have produced so far and published in the organisation, we've now got operational managers and clinicians and some of our senior managers having access to those. So they're able to access those without needing to go through the team and request access to those reports, which has speeded up that whole process and gives them the opportunity to self-serve and access that information whenever they need it. And because it's automated behind the scenes, it's as close to real time as the data allows it to be at that point, rather than looking at kind of old and out-of-date reports, which might have been the situation previously.
Sure. So that self-service was one of those key objectives.
Key factor for us.
Yeah, and allowing those users to self-serve and also to drill into the data through Power BI to get more insights from the data that's available.
Absolutely, and that's our analysts as well as the consumers of the reports. We've got a number of people in the trust who don't work in the information team who are actually very skilled at using data and understanding what it's telling them.
Yeah.
So we wanted to put that kind of power in their hands rather than it always needing to be coming from our BI team, as it were.
Yeah, okay. One of the other key objectives was security, and improving the security around the data and around who has access to the data and the service. Can you tell us a little bit about that, please?
Yeah, so previously we were emailing out reports, we were saving information on to network drives for people to access routine reports, which is always open to security risks in terms of other people accessing things that you maybe wouldn't want them to, as much as we always tried to safeguard that. Whereas obviously the new solution we put in place enables us to give access to only the people who need access to that report, using the tool and the permissions within the tool. So it really does provide that sort of secure platform to enable access to that information.
Okay, fantastic. That's good. Okay, and in terms of the benefits to the end users, what improvements have you seen? I mean, even down to sort of patient care level. How's this project affected that?
I think it's helped with the flow of patients through some of our departments. So I mentioned the example with the emergency department and the dashboard that they're using sort of close to real time. I think that visibility of where patients are in the department and how long they've waited for various parts of their pathway has enabled patients to move through the department quicker. So I think that visibility of the information is helping the patient flow, and it's also helping the operational and clinical staff sort of manage those patients through the departments as well, which has been great.
Yeah, so overall improvement on service delivery, which then filters down to patient outcome effectively, better patient outcome. Yeah. That's good. And what's it been like working with Northdoor?
Yeah, I think from day one really, we found the company very approachable, not a kind of hard sell company, which resonated well with us. I found that they listened to what we were trying to achieve, and were creative in trying to find a solution that would best fit our needs rather than trying to give us something predefined that they'd used elsewhere. which we really appreciated. They've always been very available and contactable and very responsive to our needs. And I think together we've run a really good project, and we're starting to see the benefits of that now, but I can only see that kind of growing from what we've put in place, which is really exciting.
Great. And had you spoken to other organisations before selecting Northdoor as the chosen partner? Or what was the feedback from?
Yeah, we did speak to a number of other companies that were on the various frameworks to see what other options there were. And some had some very good solutions, but as I say, I did feel that they were trying to offer us something they deployed somewhere else rather than something bespoke for our needs, which is what I felt the Northdoor solution offered us and was really what we were looking for.
Yeah, and the fact that we had a reputation within the NHS,
absolutely,
and with Microsoft.
Yeah.
So James, aside from the benefits of putting in an enterprise level BI tool and the things that we've spoken about, like time to insight and better security and self-service and the ability to have dynamic reporting capabilities, I think one of the great things about this project is the collaboration between the other organisations within the Kent County and the ability for that service to be shared and for the cost to be shared. Can you tell us a little bit about your thoughts on that and the benefits that brings, please?
Yeah, definitely. I think that was one of the key drivers for the project, is that we wanted to create a solution that was something we could all benefit from as a system. So national policy for NHS is that systems should work closer together and collaborate wherever possible, not just around patient care, but also in the back office areas such as this. So we were very keen to have a solution that enabled us to do that, and to be able to share data between trusts who previously work in quite a siloed way.
Yes.
So the solution we put in place does enable us to set up secure workspaces and share information within those workspaces, so between providers, which was always far more difficult. And we're now looking at how we can sort of extend that out to our commissioning colleagues as well, which will really reduce some of the duplication we have in terms of reporting and some of the struggles we have in terms of sharing information outside of trust boundaries. So it's the early stages of that at the moment. It's a capability we've got, and we're just trying to work together to leverage that. I think one of the positive things we've seen is that we've established a group where we've got partners meeting regularly to talk about the work they're doing and sharing best practice, which has been fun and also really sort of helpful in terms of shaping the design of reports in the local area.
That sounds great. So real collaboration going on, rather than perhaps historically people just looking after their own individual organisation.
Yeah.
That's amazing. That's great.
Yeah.
Great. Okay. Well, I mean, it's been a pleasure working with you for the last 2 years, and I'm looking forward to continuing working with you into the future. And thanks very much for being with us today.
Pleasure. Thank you.
Thanks.